Hello, this is John Kanalopoulos on behalf of my co-authors on this poster, Christina Rusu, our optometrist, and Ioana Kondari, a fellow physician in our center, the LaserVision Clinical Research Institute in Athens, Greece. I'd like to present to you the digital imaging analysis of pupil shape and size in reference to cornea apex before and after clear cornea cataract surgery. The purpose of this study is to look into a parameter that has not been evaluated extensively to the best of our knowledge and by literature search, but we feel that has significant clinical ramifications in the visual rehabilitation in the supraphakic eye, and it's related to the changes induced by pupil size and, more importantly, the centroid shift as a result of cataract surgery. We as surgeons are always aiming into placing the intraocular lens centrally in the eye, but we know that does not necessarily correspond with the visual axis. And what if the visual axis changes after cataract surgery with the physiology of pseudophakia? The aim of this work is to provide a novel investigation of pupil size and centration changes following cataract surgery based on the analysis provided by a special placido disc topography which combines pupillometry. This is the M4 keratograph by Oculus. The specific device we used is the Vario topolizer used for the purposes of topography guided treatments by Wavelight. It's the same device, though, as far as these parameters studied. To implement digital analysis of pupil imaging, so we're able, by the digital analysis of the pupil size as provided with bright light and low light conditions from the device, and also compare the centration of pupil and the centroid shift following cataract surgery. So in methods, we looked at 35 consecutive cataract cases. So 70 eyes were included in the study, and we digitally imaged pre and post operatively with the this placido topography, the Vario topolizer, which is, as mentioned, the M4 topolizer by Oculus, providing accurate pupil imaging and cornea apex identification. The digital analysis implemented investigated the Cartesian coordinates, nasal temporal being the horizontal and superior inferior being the vertical axis of the cornea apex, the approximation of the intersecting line for site of the cornea, to the geometric center, the approximate visual axis of the pupil. The Cartesian changes of the differences were associated with postoperative centroid pupil shift, and we recorded as such. Okay, let's see here a live example on how the Oculus keratograph approaches the patient. Here we can see change in luminosity of the device in recording the scotopic and mesopic pupillary size, shape, and centroid shift. On the bottom, you can see the dynamic graphs of all these measurements, and soon we'll see the report giving us the dimensions of the photopic, scotopic pupil here and the centroid shift. Thank you very much for your attention. So as a result, we found that the pupil size diameter change corresponded to a relative reduction of about 10% for the photopic and also 10% for the mesopic pupil. And we found that this difference before surgery and after surgery was statistically significant for both lighting conditions, with p-values of significance of 0.045 and 0.011 respectively. In addition, there's a noted reduction in the centroid shift from the average for all eyes 0.12 millimeters, so this is 120 microns preoperatively, to 0.05 millimeters, which is 50 microns postoperatively, as a result of the postoperative less temporal horizontal difference between the cornea apex and the pupil center. And the graphs of these findings are seen here on the slide. The changes in the pupil diameter on the top histogram, with the first column showing the photopic pre-op pupillary size, the second green showing the scotopic preoperative pupillary size, and then the other two, the respective photopic and scotopic postoperative pupillary sizes, and these box plots represented here. And then the graph under that shows the small pupil distance from the apex, so the centroid shift for preoperative and postoperative respectively. And on the bottom you can see the appropriate pre and post on one case example, changes in the pupillary size in photopic and scotopic conditions as they're reported by the specific device. So in discussion, the present study suggests a statistically significant reduction in pupil size. The postoperative pupil size reduction averaged, as mentioned before, about 10%, and small pupil about 10%. These findings may be further suggestive of the safe use of a 6mm optical zone diameter IOL instead of a larger zone as used to be performed mainly in the past. The noted postoperative reduction in pupil size suggests that even a preoperative pupil diameter of 5.5mm may be postoperatively 5mm as an indirect result of cataract surgery. Additionally, there is a noted reduction in the centroid shift from an average, and we're looking at all eyes here, 120 microns preoperatively to 50 microns postoperatively as a result of the postoperative less temporal horizontal difference between the cornea apex and the geometric pupil center. These changes may be related to the increased anterior chamber depth and volume following the extraction of the much bulkier crystalline lens and the replacement of that lens with the intraocular lens. As it develops into a cataract, an intumescent crystalline lens has measured average thickness 4.4 millimeters. This lens is replaced with a thin IOL, which thickness in its center is usually less than a millimeter. And on the right side here, the top, you can see the differences in centroid shift from preoperative to postoperative. Preoperative is orange, postoperative is green, and the large pupil center distance from the apex on the bottom graph, showing the preoperative again in orange and the postoperative in green. These findings, and we can see the detailed tables with the data described before, do generate more questions than actually answers given. And the optical considerations are here that the pupil size investigated in the study corresponds to the apparent, the entrance pupil, meaning the virtual image of the physical pupil as imaged through the cornea. In other words, the image capture of the pupil corresponds to the entrance pupil and not the anatomical pupil as has been reported previously. As in any optical system, the entrance pupil may be magnified, virtual image of the aperture, i.e. the anatomical pupil. This is how the observer sees the pupil. The magnification depends on the actual distance of the anatomical pupil from the cornea approximated by the anterior chamber depth, otherwise noted as ACD, the refractive indices of the media beside the cornea as well as the cornea refractive power. In an ametropic eye, the average total cornea power is plus 43 diopters and the ACD 3.6 millimeters, and the optical properties of the aqueous, the index is 1.336. The apparent pupil is about 13.1% larger and a 0.55 millimeters or 550 microns closer to the cornea than the anatomical pupil actually is. According to visual optics calculations that we have applied, assuming that the cornea is not subject to refractive change in cataract surgery, there are minute changes as we know. The pupil magnification factor of the apparent pupil is approximated to 11.7% of the preoperative eyes and 15.9% of postoperative eyes due to the change in the anterior chamber depth, and that's also a calculation we performed in the study. These results contrast, for example, to a refractive intervention by alteration of the anterior cornea power, as it happens in PRK or LASIK, in which the pupil magnification changes can be attributed to changes in the cornea refractive power, not the anterior chamber depth. Thus, in our study, to the preoperative anatomical pupil diameter corresponds a 0.895 fudge factor, and to the postoperative a 0.863 fudge factor of magnification, respectively, which do not seem to have a significant difference. Thus, these data are considered quite objective. In conclusion, we showed that cataract surgery results in pupil size reduction in order of 10% for both mesopic and photopic conditions, and an improved, we find this very important, centration, or rather reduction in centroid shift towards a smaller centroid shift. Specifically, a smaller pupil size and less temporal shift was recorded post-clear cornea cataract surgery than cataract surgery patients that had cataracts, clinical cataracts. These data may have clinical reference in targeted intraoperative IOL centrations and should be considered by the clinician when lenses are centered, especially if a toric lens is centered or a multifocal or diffractive lens is placed in the eye. This novel investigation of digital analysis of pupillometry of high analysis infrared camera that comes along as an adjunct with this topography device suggests that cataract surgery reduces in pupil size and improves centration after cataract surgery. As mentioned before, these findings may have a clinical significance in reference to targeted intraoperative IOL design and centration for the manufacturer of intraocular lenses and the clinician. And subsequently, the submission of this paper has been published in the Journal of Cataract and Refractive Surgery, and you can see excerpts from that publication in this last final slide. And thank you very much for your attention.